with Mayo Clinic to give you the latest in heart health news. And while we usually discuss ways to keep you heart healthy, today we want to talk about heart failure. I want you to meet Dr. Eric Steidley. He is a Mayo Clinic cardiologist, and he says that there are some breakthroughs and devices to help patients manage their heart failure. And it's good to see you. Welcome back to the show.
Thanks so much for having me.
No, I have learned so much from you already, and I hope, anybody watching at home, if they are experiencing heart failure or dealing with it, this is very important. But how many people actually die with heart failure?
So heart failure is all too common in the United States. About 5 million people in the U.S. have it, about 500,000 new cases a year, and probably about 300,000 of those folks will pass away of heart failure.
And here's the sad part. You can prevent it. In some cases, not all cases.
Well, the two most common causes of heart failure, high blood pressure and heart attacks.
Okay.
So those two things are in a way preventable, right? We can have healthy living and we can prevent those things, but once those things happen, heart failure often ensues.
All right, let's talk about this breakthrough in technology that you guys are offering. If you take a look at this little device right here, tell me, it's so teeny tiny. I put actually a quarter there so that you could see the size of it. What is this called?
So this is the CardioMEMS intracardiac or inside the heart pressure monitor.
And what does this do?
So this sits inside an artery in the heart, and it measures the pressure. So we talked about heart failure, and what happens in heart failure is the pressures in the heart build up, and that causes congestion or fluid buildup. This allows us to detect that buildup even before it would start bothering you, so we can act on that.
All right, here's what's amazing. We could have some animation to kind of walk you through the process. So somebody comes in and they are a good candidate for this. Tell me what we're seeing here.
So this is an animation of it going up to the leg, inside the heart. It's done in a minimally invasive procedure. It sits inside the pulmonary artery. Blood goes through the pulmonary artery. We release the device. It anchors itself with these two little wire loops, and it'll sit there for the rest of your life. It'll just not bother you, and that little metal deflects when there are increased pressures. You lay on a pillow. When you hit the button, the device sends a signal back to the pillow and lets us know what the pressure inside the heart is.
Okay, so, and this blows my mind. This is the pillow here, and this is something that the patient would have at home. Every day when they lay on that pillow, you are getting an update on what's happening.
Right, exactly. So there's a painless radio signal that gets pinged out of this pillow. It hits the little device, and just like bouncing off a glass, it sends a signal back to the pillow. So this little device, without a battery, it lasts forever. So
when you get some information back, let's say, okay, no news was good news on most of the time, but what is it that you might find that would be helpful to the patient who has this implanted device?
Well, right now, before we had this device, we would have to wait for you to develop symptoms of heart failure, fluid buildup either in your lungs or your legs, that would prompt you to seek attention. Now we can, before that fluid builds up, pressure rises inside the heart, and we can adjust your medicines or change other things with your diet perhaps, go on a low-salt diet, and sort of head things off at the pass.
Wow.
So early detection.
That is amazing. It's truly amazing. It's being proactive instead of reactive. And talk about real quickly for me a good candidate for this type of implant. Who is that? Probably
it'd be someone who has heart failure, who maybe has been in the hospital once or twice already and is having problems juggling their fluid.
Okay, because you said to me earlier, chances are if you've been in once or twice, you're going to be back again, and this is one way to prevent something fatal happening.
Exactly.
All right, Dr. Steidley, you are so good at what you do, and thank you for explaining that all and making it very simple.
Thanks so much for having us.
We appreciate that. All right, let me give you some information to make an appointment for an evaluation with a Mayo Clinic cardiologist. Perhaps you're thinking this device might be something that will work for you. Here's the number to call, 480-301-8200 to set up that consultation. And of course, You know, don't forget ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month we will give you easy to follow recipes and ideas to help keep you and your loved ones heart healthy. You want to prevent getting this implant,
Yes.
right, doctor? Okay, to learn more and get our Rally for Red reminders, just sign up at abc15.com/rallyforred.